All right, I believe the patient may be
We'll
here
try
right
to meet
now.
her now.
Ms. Harper?
Yes.
Hi, I'm Mike Sullivan from the Ethics Committee. Come on in.
Hi, Ms. Harper, I'm Dr. Murphy.
I'm Ross Feeler, nice to meet you.
Nice to meet you.
Do you want to have a seat over here?
I work in administration. I also work as part of the Ethics Committee. And I understand that you have some concerns regarding your mom and regarding the care that she's currently receiving. So we've invited Dr. Murphy, if we could come together and just kind of talk. And I thought I'd first start off, if we could just ask Dr. Murphy just to give us an overview of your mom's medical care.
Okay, sure.
And then see if we have any questions and kind of go from there. Is that okay?
Sure.
Okay.
Okay. Well, I understand that she suffered a cardiovascular accident of some sort, and that
She had a stroke, right?
right, she had a stroke, and it's resulted in a 7-centimeter right-sided,
Which is huge.
which is very large. It is a serious situation. She has been able to breathe partially above the ventilator. She's been intubated, as you know, and some of the things that concern me are that I think it's too soon to know if she would be able to wake up. I think we need to give her a little bit more time to see how well she's going to do. It's a little too premature to make any kind of decision at this point. I think we need to give her a little bit more time. And the reason for this is because the kind of stroke she has is a hemorrhagic stroke and not an ischemic stroke. And that means that she may actually improve to the point of regaining consciousness. Now, I don't know if this means that she may be able to recognize other people or even who she is as a person, but I think we owe it to her to find out. And I don't feel comfortable withdrawing care at this point.
See, I mean, I was an ER nurse for 3 years, and I've seen people come in with these strokes, and I know my mother. I mean, believe me, it's not an easy decision to make, but I know very clearly her wishes because my step-aunt, I guess you would call it, has been in her care up until 2 days ago, and she had a stroke 8 years ago, and my mother has said over and over and over, I don't want this, I don't want to linger. So, I mean, I don't even know how long she was unconscious before she came in here, but I know what a huge stroke it is, and even if she's able to become conscious, she may never be able to communicate or have any kind of life. I mean, we could be talking, you know, a trach tube, a feeding tube, a colostomy. I mean, that's not what she wants. I just know that's not what she wants.
I hear what you're saying about your aunt, your step-aunt. I think, you know, there's so many different kinds of stroke, you know, so many different ways in which this can affect different patients, and you know, I don't know what kind of stroke your aunt had, but you know, they each manifest in different ways and have very different kinds of outcomes. And I just want to be sure that in your mother's case, also because of the fact that this stroke was not in the dominant hemisphere, so there is that possibility, and I think we really have a chance that we need to offer to her.
You know, what I don't understand is the only reason we moved her here in the first place was that I was told that there was a good possibility that there would be a surgical alternative.
Yeah, that was
And I mean, that's what got her intubated, which, you know, is not a pleasant experience to begin with, and flown here, and now I'm told that that's not an option, and kind of wrapped my mind around that. So, again, I don't want this lingering, well, she's coming back a little bit. She's, maybe if we just put in the trach tube and we just keep her going another couple weeks and see how it goes. That's exactly what she doesn't want. I mean, I just see it being a real dangerous area, and she's not able to communicate now. So, I mean, I don't want, what happens if she ends up in a quasi-vegetative, we can keep her alive state forever and ever? I mean, what's the difference between today and tomorrow and next week and 3 months from now?
I don't think we're going to be talking about 3 months right now. I think what we need to do is focus on the present and see what kind of opportunities emerge. Let's give her a chance to tell us what she needs by...
But what if she can't tell us?
Well, I'm not talking literally. I'm just telling you by the way she manifests herself over the next couple days. I think we need to give it a little bit more time to see which way she'll go.
We were talking a little bit about time parameters before you came in, so maybe, could we just kind of review that a little bit? I mean, what are the timeline markers that would give you some indication of where she's going?
I need about 5 days at minimum to really see how she's doing.
See, and this is what makes me nervous right away. You say 5 days at minimum, and so, I mean, there's your out to, well, I really need another 4 days, I really need another week, and suddenly, it's just exactly what she doesn't want.
Is there a possibility of defining a specific time frame?
5 days is, as I mentioned to you earlier, I can mention to you again that this isn't the kind of thing that evolves overnight. It takes a little bit more time to see the gradual trend in which she evolves. So we need that period of 5 days to really get a sense as to which way she's going to go. And then we can revisit this whole situation again. And at that point, I'm happy to.
So we're in the 3rd day of that right now, then, is that what you're saying?
At least 5 days from now.
5 days from now.
Because I just don't know.
Patty, can I ask you a specific question? So okay if I call you Patty?
Yeah.
Can you share with me what your mom's values are regarding issues of this concern? You said your mom took care of your step-aunt,
Yes.
who also had a stroke, and she shared with you.
She up until 2 days ago, she is still caring for her. I'm sorry.
Well, what are your mom's values regarding if she experienced a stroke or had a major event happen?
She's always said, and especially in the last 8 years since caring for my aunt, that she doesn't, if anything happens to her where she's incapacitated and her quality of life goes down to the point that she's was an incredibly active woman, I mean literally up until 2 days ago, that she did not want to linger in any way where she was not enjoying an active quality of life and in any way causing a burden on anyone else. She's happy to be caring for my aunt, but in any way doing that to anyone else. And it's because of her experience, I just think that's a really strong feeling of hers. She's a religious woman, she's active, she was interested in life, she has no desire and no feeling that she's ready to die.
Right.
But I just see her not, even if she regains consciousness.
Well, don't you want her back? I mean, if she has that ability to regain consciousness, don't you want
Are you
her...
telling me that I don't want my mother to be alive? I'm sorry, yes, of course I want my mother here. But I don't want her here in a way that she is unhappy, and I think she would feel, if she's even able to reach that level of consciousness, that that's a betrayal of her wishes. And I guess beyond that, my biggest fear is just, at what level is she going to come back? I've seen these strokes victims come in over and over and over. And yes, you can keep them alive and you can keep them minimally conscious enough to know how much discomfort and pain they're in. And that's not something I would wish on my mother, who is the dearest person in my life.
So what you're saying, Patty, is you're looking at the quality of life of your mom.
Yes.
Can I explore another option with you?